There is a particular frustration in investing time, money, and effort into a skincare routine while unknowingly undermining it with makeup habits that work in the opposite direction. Dermatologists consistently see patients dealing with clogged pores, persistent breakouts, contact dermatitis, and accelerated skin aging that trace back not to their skincare products, but to how they apply, remove, and manage their makeup. The good news is that none of these habits require giving up makeup to fix. They require only a few adjustments to how makeup is used. Sleeping in makeup. Sleeping in makeup is the habit that dermatologists and makeup artists alike flag most consistently as damaging to skin health, and the mechanism is straightforward. Skin undergoes significant repair and regeneration during sleep, a process that requires unobstructed pores and contact with the air. Makeup left on overnight blocks this process physically, trapping dead skin cells, sebum, environmental pollutants, and product residue in pores that would otherwise clear themselves through the night. The result is congestion, enlarged appearing pores, and the bacterial environment that drives acne breakouts. The secondary consequence is pillowcase contamination. Product residue transfers from skin to fabric each night, and sleeping on that same pillowcase repeatedly re-exposes skin to accumulated makeup, bacteria, and irritants. This can cause contact dermatitis, an inflammatory skin reaction that produces redness, itching, and rash in areas of skin that have repeated contact with contaminated fabric. Dermatologists recommend washing pillowcases at least weekly and, when possible, switching to silk or satin materials that cause less mechanical friction on skin during sleep. For nights when a full cleansing routine feels impossible, a micellar water applied with a cotton pad followed by a gentle water-based rinse provides a minimum acceptable alternative to wearing makeup through the night. Treating SPF makeup as adequate sun protection. The proliferation of foundations, tinted moisturizers, BB creams, and CC creams containing SPF has created a widespread and genuinely problematic misunderstanding about sun protection. These products are not adequate substitutes for sunscreen, and dermatologists are consistent and emphatic on this point. The American Academy of Dermatology recommends a daily broad-spectrum sunscreen of at least SPF 30 applied as a distinct skincare step, not as a benefit absorbed from makeup. The problem is application quantity. The SPF rating on any product reflects the protection achieved when the product is applied at a standardized density, approximately 2 milligrams per square centimeter of skin surface. This translates to a quantity of product that is considerably more than most people apply when using a tinted moisturizer or foundation for cosmetic coverage. The amount of SPF makeup that would need to be applied to achieve its stated protection level would look and feel absurd as a cosmetic application. In practice, most people apply 1/3 to 1/2 of the protective quantity when using SPF makeup for coverage, which means the actual sun protection being received is a fraction of what the SPF number implies. The practical approach is to apply a dedicated SPF 30 or higher sunscreen as the final step of morning skincare. Allow approximately 5 minutes for it to absorb and dry down before applying makeup, and treat any SPF in makeup products as an incidental bonus rather than a primary protection strategy. Using makeup wipes as the only cleansing step. Makeup wipes are useful tools in specific situations, but relying on them as a complete makeup removal method is one of the most common sources of skin congestion that dermatologists and makeup artists encounter. The limitation is mechanical. Wiping across the surface of skin removes visible makeup from the outermost layer, but the pores of skin, like the pits in an orange peel, are three-dimensional structures that a flat wipe moving across the surface cannot adequately clean. Foundation, concealer, and other products remain lodged in pore openings where they contribute to blackheads, breakouts, and dull complexion. The solution is double cleansing when wearing significant makeup. The first step uses an oil-based cleanser or cleansing balm to dissolve the oil-soluble components of makeup, including foundations, sunscreens, and long-wear formulas, breaking them down at the molecular level so they can be thoroughly rinsed away. The second step uses a water-based facial cleanser to remove water-soluble residue and complete the cleansing process. Dermatologists note that oil cleansers should be rinsed thoroughly to avoid residue that can clog pores, and people with acne-prone skin should confirm their chosen oil cleanser is specifically formulated to be non-comedogenic. For people who do use makeup wipes as a first step, using different sections of the wipe for different areas of the face prevents the redistribution of removed makeup across the skin, and a water-based cleanser should always follow. Skipping patch tests on makeup with active ingredients. The boundary between skincare and makeup has become considerably less distinct as formulators incorporate active skincare ingredients into cosmetic products. Foundations, concealers, and setting powders now commonly contain niacinamide, vitamin C, hyaluronic acid, retinol derivatives, and alpha-hydroxy acids. These ingredients can provide real skin benefits, but they can also cause sensitivity reactions, particularly in people who have not built tolerance to them through their skincare routine. The assumption that makeup products are categorically gentler than skincare products and therefore do not require patch testing is incorrect and is a source of unexpected breakouts, redness, and irritation that dermatologists frequently see. Before using a new makeup product containing active ingredients, apply a small amount to a discrete area of skin, the inside of the forearm, behind the ear, or on the neck, and observe the area over 24 to 48 hours. This brief precaution can prevent the considerably more disruptive experience of discovering an incompatibility after applying a product across the entire face. Sharing or testing makeup improperly in stores. Testing makeup in retail environments is a reasonable part of shopping for products that vary significantly in how they perform on different skin tones and types. But the practice carries a real bacterial contamination risk, particularly for products applied near the eyes and lips, and for liquid formulas that contain water and therefore provide a hospitable environment for bacterial growth. Eye makeup testers used directly on the eye area can transmit bacterial and viral infections, including conjunctivitis. Lip product testers carry similar risks for herpes simplex transmission. The practical approach to in-store testing is to use disposable applicators rather than the product's own applicator to test eye and lip products on the back of the hand or wrist rather than directly on the intended application area, and to prioritize testing of shades and finishes rather than attempting a full face application in a retail setting. Ophthalmologist-tested and dermatologist-tested product designations are worth seeking when purchasing eye makeup in particular, as these indicate a higher standard of testing for ocular safety. The overlooked habits. Beyond the 5 primary habits, 2 additional practices receive consistent mention from dermatologists. Using expired makeup products is a direct skin health risk. Cosmetics contain preservatives that prevent bacterial growth, and those preservatives have a defined effective period. After the period indicated by the period after opening symbol on the packaging, typically 6 to 12 months for most liquid products, the preservative system can no longer be relied upon to prevent bacterial proliferation. Using expired products puts contaminated material directly onto skin, a straightforward path to breakouts and infections. Unwashed makeup brushes and sponges accumulate bacteria, dead skin cells, old product, and sebum with each use and redeposit all of it onto skin with every application. Dermatologists recommend washing makeup tools at least weekly for those who wear makeup daily, using gentle soap or a dedicated brush cleanser, and allowing tools to dry completely before their next use. The consistent thread across all of these habits is that protecting skin health while wearing makeup requires treating the full cycle of application, removal, and tool maintenance as part of the same routine rather than focusing only on what goes onto the face.